The world has been grappling with an unprecedented health crisis since the emergence of the novel coronavirus, officially named SARS-CoV-2, which causes coronavirus disease 2019, COVID-19. This highly contagious virus has spread across the globe, affecting millions of lives and reshaping the way we live. In this comprehensive blog, we will delve into the prevention, symptoms, and management of COVID-19 to help you navigate through these challenging times. COVID-19 primarily spreads through respiratory droplets when an infected person coughs, sneezes, or talks. It can also spread by touching surfaces contaminated with the virus and then touching the face, especially the eyes, nose, or mouth. The virus can survive on surfaces for varying periods, depending on the material. Preventing the spread of COVID-19 involves a combination of personal hygiene practices, vaccination, and societal measures. Here are some key preventive measures. 1. Vaccination. Getting vaccinated is one of the most effective ways to protect yourself and others from severe illness and hospitalization due to COVID-19. Vaccines stimulate the immune system to recognize and fight the virus, reducing the risk of infection and its complications. 2. Hygiene practices. Hand hygiene. Wash hands frequently with soap and water for at least 20 seconds, especially after being in a public place, touching your face, or after coughing or sneezing. If soap and water are not available, use a hand sanitizer with at least 60% alcohol. Respiratory hygiene. Cover your mouth and nose with a tissue or your elbow when coughing or sneezing. Dispose of used tissues immediately and wash hands. Avoid touching face. Avoid touching your eyes, nose, and mouth with unwashed hands to prevent the transfer of the virus from surfaces to your face. 3. Physical distancing. Maintain at least 6 feet of distance from people who are not from your household, especially in crowded places. Physical distancing helps reduce the risk of airborne transmission. 4. Wearing masks. Masks, particularly N95 respirators or well-fitted cloth masks, play a crucial role in preventing the spread of respiratory droplets. They protect both the wearer and those around them. Follow guidelines from health authorities regarding mask usage. 5. Cleaning and disinfecting. Regularly clean and disinfect frequently touched surfaces, such as doorknobs, light switches, countertops, and electronic devices. This helps reduce the risk of surface transmission. 6. Avoiding crowded places. Limit your exposure to crowded places, especially in enclosed spaces where ventilation may be limited. Choose outdoor activities whenever possible. Recognizing the symptoms of COVID-19 is crucial for early detection and timely intervention. The symptoms can range from mild to severe and may appear 2 to 14 days after exposure to the virus. Common symptoms include 1. Fever and chills. A high body temperature is a common early symptom of COVID-19. Chills may also accompany fever. 2. Cough. Persistent cough, often dry and irritating, is a hallmark symptom of COVID-19. 3. Shortness of breath. Difficulty breathing or shortness of breath may indicate a more severe respiratory infection. 4. Fatigue. Feeling unusually tired or exhausted, even with minimal physical exertion, is a common symptom. 5. Muscle or body aches. Generalized body aches and muscle pain may be present. 6. Headache. Persistent headaches, sometimes severe, have been reported in COVID-19 cases. 7. Loss of taste or smell. A sudden loss of taste or smell, known as anosmia, is a distinctive symptom of COVID-19. 8. Sore throat. A sore throat can be an early symptom similar to other respiratory infections. 9. Congestion or runny nose. While less common, some individuals with COVID-19 may experience nasal congestion or a runny nose. 10. Nausea or vomiting. Gastrointestinal symptoms, including nausea and vomiting, may occur in some cases. If you suspect you have COVID-19 or have been in close contact with someone who tested positive, it's crucial to follow public health guidelines and seek medical advice. Here are key aspects of managing COVID-19. 1. Isolation. If you have symptoms of COVID-19 or have tested positive, isolate yourself from others, including those in your household, to prevent the spread of the virus. 2. Medical consultation. Contact your healthcare provider for guidance on managing your symptoms and follow their advice, especially if you have underlying health conditions or experience severe symptoms. Monitoring symptoms. Regularly monitor your symptoms, especially respiratory symptoms like shortness of breath, Seek immediate medical attention if your condition worsens. 4. Fluids and rest. Stay well hydrated by drinking plenty of fluids. Get adequate rest to support your body's immune response. Number 5. Over-the-counter medications. Over-the-counter medications may help alleviate symptoms such as fever, cough, and body aches. However, consult with your healthcare provider before taking any medications. 6. Hospitalization. Severe cases of COVID-19 may require hospitalization, especially if there are signs of respiratory distress or other complications. Oxygen therapy and other medical interventions may be necessary. 7. Quarantine and contact tracing. If you have been in close contact with someone who tested positive for COVID-19, follow quarantine guidelines to prevent further transmission. Cooperate with contact tracing efforts to notify individuals who may have been exposed. 8. Follow public health guidelines. Adhere to public health guidelines and recommendations from health authorities. Stay informed about updates and changes in guidelines. Some individuals, even those with mild or asymptomatic cases, may experience lingering symptoms long after the acute phase of the illness. This condition is commonly referred to as long COVID or post-COVID syndrome. Symptoms may include fatigue, difficulty concentrating, brain fog, persistent shortness of breath, and other health issues. Research is ongoing to understand and address these long-term effects. The COVID-19 pandemic has presented unprecedented challenges to individuals, communities, and nations worldwide. By understanding the virus, adopting preventive measures, recognizing symptoms early, and seeking timely medical care, we can collectively navigate through these challenging times. Vaccination remains a critical tool in the fight against the virus, providing a pathway toward a safer and healthier future. As we continue to adapt to the evolving situation, staying informed and following public health guidelines will be essential in overcoming the impact of COVID-19 on a global scale.